Hello, everyone. Welcome to our presentation. My name is Joerg Schwarz. I'm Senior Director for Healthcare Data at Infor. And we will talk about a little bit more than just clinical data, clinical quality data reporting. We'll talk about the whole process that leads up to the reporting. When you think about electronic clinical quality measures, a lot of people think about claims data. And because a lot of clinical quality measures today are based on claims data, the underlying data is usually outdated. The data is 6 to 9 months old, so it's not really actionable. So the really key thing that we are talking about here is to make the underlying data, clinical data, in near real time, and thereby making the use of clinical quality measures actionable. That's really the point that we're talking about today. So what are the challenges that we're trying to solve in population health management? Most ACOs in the country have 6 or more EMRs. If all the data was sitting in an EMR, you could use the EMR to do quality reporting, and you could also, of course, use it in almost real time. But the reality is that the data sits in many different EMRs. If you are working in an accountable care organization, you need to collaborate with a lot of specialists that usually have their own EMRs. You have to bring in all this data from the specialty EMRs, and then you can start identifying gaps in care and identifying if there's anything that needs to be done with a patient. So that's exactly what our solution addresses. We collect the data from all the data sources in the accountable care organization. We cleanse the data. We put it into a FHIR format. But since we've been doing this for a long time, we also know that just putting data into FHIR doesn't mean it's really usable for data analytics. So you have to curate the data in a lot of ways, and we will talk to you about exactly how we curate the data so you can actually run analytics on the data and you can use it to identify gaps in care. The key components of the solution are based on Infor Cloverleaf. Cloverleaf is one of the interoperability engines that's been around forever. Obviously, we keep it up to date. It runs in AWS. We offer it as a fully managed service. It provides services like real-time translation from HL7 v2 into HL7 FHIR and from FHIR into HL7 v2. We also translate from CDA into FHIR, etc., etc. Last year, we introduced a service called IFOR, Infor FHIR On-Ramp, which is optimized to not only translate the data into FHIR, but also to upload it into AWS HealthLake. Once the data sits in AWS HealthLake, there's a lot of services that we can utilize from AWS to treat the data, to curate the data, and to bring it in that format that I was talking about earlier, suitable for analytical purposes. One of the motivations to build a more robust solution for electronic clinical quality measure reporting is a CMS requirement that by 2026, for the 2025 fiscal year, you have to start reporting on quality measures for the entire population, not only on a sample. Today, a lot of times, providers curate the data more or less by hand. So they bring the data from the different data sources together. They do a lot of the semantic interoperability, so to speak, by hand. And that's okay if you do this for a small sample of 200 or 300 patients. But with the new requirement where you have to do it for the entire population, which could be 50,000, 200,000, or even millions of patients, that manual process is not suitable anymore. So that's why we thought it's the right time to build a solution that is more robust and that scales to the entire population. What we're showing here on the slide are the first three measures that are required by CNS to be reported on. But the solution that we build and that we show you in more detail actually covers a lot more than these three measures that are required. So I will hand it over to my colleague, Dr. Alex Taylor, who joins us from London. And he will go into the detailed components of our solution and will actually show you how the solution works. So Alex.
Thank you, Joerg. Okay, so as Joerg suggested, we've built this solution. It's now working end-to-end, powered by synthetic data in a AWS sandbox. But the idea was to develop and deploy the solution. It runs entirely on AWS components. It's all written in Terraform, so it can be spun up and deployed turnkey into a client's AWS premise, with the idea being that we bring the application to the data rather than try to take the data out of where it lives. The central components of the solution are data is ingested from a variety of formats, transformed into HL7 via Cloverleaf. It's loaded into AWS HealthLake. We use, for example, Amazon Comprehend to pass codes out of any unstructured data that's present. But otherwise, the real magic all happens over here. What we've built is, in fact, a large-scale clinical knowledge graph that lives inside of Neptune. It's got 200 million nodes and edges in it. It's got every long-term condition and the drugs that are used to treat those conditions. And crucially, it's got all of the payment rules relating to ECQMs and population health management. So we take the unstructured data, we use AI to map it to nodes in that knowledge graph. And then in that way, we are able to create these patient subgraphs that enable us to identify care gaps and quality gaps to feed out to power an analytics interface that allows an ACO to do their population health management. Maybe just to run you through a quick example of what this looks like in action. So we have the knowledge graph. For each measure individually, we develop, we extract what we call a rules engine, which are basically the inclusion and exclusion criteria and the exceptions. One patient at a time, we take the longitudinal patient record, we run it through the rules engine, which comes back and says, yes, this patient is in the cohort and they've met the requirements, or this patient's excluded, or this patient hasn't met the requirements and they need an intervention. So let's take an example. For a given patient here, having taken all of the FHIR data out of HealthLake, applied the rules engine, we can say, yes, this patient meets the inclusion criteria. They've got atrial fibrillation. They've had the required services. We can check them off the list of having met the requirements and they've had the care that they need for the year. And then we do that one patient at a time for an entire population in order to calculate the numerators and denominators that the CMS needs reported to it to track performance and pay these bonuses under the population health scheme. All of these insights get funneled back to the ACO via a dashboard. We're here for tomorrow and Thursday. We have a booth here on site. We'll be really happy to show you what the knowledge graph looks like and to take you through the dashboard in a lot more detail. But the central idea is that a population health manager should be able to track their progress across every indicator, to track provider performance, to forecast whether they're on target, and critically to have the ability to see where there are quality gaps and what is the action that they need to take in order to close those gaps such that they can hit their targets and ultimately get those incentives. Joerg, do you want to wrap up?
Yeah, thank you, Alex. Just a few more words. When you look at the dashboard, you see a couple of features here. For example, I mentioned that CMS requirement is only for 3 quality measures. And you see here that we support already a lot more than 3 measures. So actually, over 200 measures are already built in the knowledge graph and can be mapped from the fire data. And then the population health manager can use the data in various ways. As Alex mentioned, the dashboard will be an option, but we also provide, of course, an API interface, so you can use the front end of your choice for this. So with that, I want to conclude the presentation. I want to thank Alex for joining me today. We will have several other events where we'll talk in more depth about this. As Alex said, you can come to our booth here, to the demo pod, and to our booth, the Infor booth 2621, to see an in-depth demo. We also have a market debut session later today and a focus group on Thursday. So if you want to dive more deeper, we'll have plenty of opportunities to do that. Thank you very much and hope to talk to you soon. Bye.